Hi, I'm Brad Randleman. I've been performing refractive surgery for more than 20 years. I'm excited you're interested in correcting your vision with one of our 3 all-laser procedures: all-laser LASIK, SMILE, and PRK. Over the next few minutes, we'll be going over what could make you a candidate for refractive surgery, some of the risks, and what you'll experience during your procedure.
Here's what could make you eligible for Cole Eye's all-laser procedures. Your refractive error is in a range we can effectively treat. You have a stable prescription. You have overall healthy eyes without any past eye problems, and your eyes are free of disease and infection. Your body is in good general health. Your cornea is thick enough for reshaping, and you have realistic expectations regarding what the surgery can accomplish.
We hope that helps you understand what could make you a candidate for refractive surgery. Of course, if you have any questions about the procedure, just ask, and I or a Cole Eye staff member will be more than happy to answer them. At Cole Eye, we offer a team approach in practice where you may see other doctors to accommodate your schedule. But rest assured, you'll always have the opportunity to see your surgeon. Now let's take a look at what you can expect the day of your surgery. Since LASIK is the most widely performed laser refractive surgery, we'll use that as an example and discuss the differences with other procedures in the following video.
Cleveland Clinic Cole Eye Institute's all-laser procedures are designed to be fast, painless, and as comfortable as possible. To make you more relaxed and help provide the best possible outcome, we offer medicine to take before the procedure. During surgery, all you need to do is relax and focus on the green light above you. Don't worry about moving. Your eye is tracked 500 times a second to adjust to any shifting. While tracking, a laser vaporizes your eye's corneal tissue, avoiding any burning or painful sensations. You can breathe easy, knowing the machine is doing all the work. Let's take a closer look. At the start of all-laser LASIK, your eyes will be numbed with eye drops and prepped. When you're ready, we'll place you under the femtosecond laser system that will create a flap in the cornea. The flap is folded back to expose the inner corneal tissue to be treated. An excimer laser will then sculpt the corneal tissue to correct the visual defect in just a few seconds. The flap is then folded back into the original position, protecting the eye like a natural bandage. It adheres naturally to the cornea. Once your treatment is complete and we have reviewed your post-operative instructions, you will be free to go home for a well-earned nap.
And that's it. In 15 minutes or less, your surgery is complete and you're on your way to clearer vision. Now, SMILE and PRK employ slightly different techniques to reshape your cornea. We'll cover those procedures in the next videos. As with every surgical procedure, there are some risks. But with LASIK, SMILE, and PRK, the chance of complications are extremely rare. Here are the most important things we would like you to know about.
After surgery, there's a very small chance of inflammation. If inflammation occurs, we will increase the dosage of your anti-inflammatory drops. The risk of infection is approximately 1 in 10,000 for LASIK and SMILE. To reduce that risk, you'll be prescribed antibiotic and steroid drops immediately after surgery. With LASIK, there is a small risk of your flap moving in the early post-operative period or later on as a result of trauma. The risk of your flap shifting and needing to be repositioned is about 1 in 500, and it can usually be repositioned without further complications. There's a lower risk of this happening with SMILE surgery because no flap is created. If we do not fully correct your vision after one surgery, you may be eligible for a retreatment or enhancement. Enhancements are necessary in 1 to 2% of our patients. We'll bring you back for another procedure to retreat your correction.
So those are some of the risks associated with refractive surgery. I want to emphasize that LASIK is regarded as one of the safest procedures available to correct your vision. In fact, it's considered to be one of the safest procedures in medicine today. Now, there are some side effects, but these conditions are expected and should fade over time. Let's go over the ones you're more likely to experience.
The feeling of dryness is common early after surgery. This symptom typically recovers back to the patient's preoperative state within the first weeks to a few months after surgery. Glare is another temporary side effect you can experience. Routinely wearing sunglasses and avoiding harsh lights will make it easier on your eyes as they heal. Expect to see halos around light sources, especially at night during the first few weeks of recovery.
Immediately following surgery, your eyes will typically feel scratchy and irritated, and your vision will be blurry. But most patients are able to assume their normal activities the following day. So that wraps up our overview of our all-laser refractive procedures. We focused on LASIK, but the slightly different techniques used in SMILE and PRK could be better suited for addressing your refractive error. I'll fill you in on SMILE in the next video. In this video, we'll be focusing on our single laser SMILE surgery, which is a relatively newer procedure, but has been in use for more than a decade. The eligibility criteria for SMILE are the same as for LASIK, and during surgery, you'll have the same green light to focus on to keep your eye steady. But SMILE's technique has one key difference.
SMILE, known as a minimally invasive and flapless surgery, is the third generation of laser vision correction beyond PRK and LASIK. The femtosecond laser system creates a thin lenticule and a small incision measuring less than 4 millimeters in the intact cornea in a single step. The surgeon manually removes the lenticule through the small incision. No flap needs to be cut, so there is only a minimal disruption to the biomechanics of the cornea. The minimally invasive removal of the lenticule changes the shape of the cornea, thereby correcting the visual defect of the eye.
So the distinction with SMILE is that no flap is created during surgery. This difference impacts your recovery as compared to LASIK and PRK. Let's go over what you might experience after SMILE surgery.
After surgery, you can expect a similar recovery period to LASIK of about 3 to 6 months, but that time can vary more with SMILE. SMILE has been shown to have some advantages in terms of dry eye for the first few months after surgery. If you experience dry eye symptoms, then SMILE may be a good option for treating your refractive error. If you have a high-energy career or are active in contact sports, SMILE might be a better option because of its lower risk of eye trauma.
Most patients who are candidates for all procedures choose either SMILE or LASIK due to the early comfort and quicker vision recovery. SMILE cannot currently correct farsightedness or higher ranges of astigmatism. This is where LASIK or PRK would be a better option. And speaking of PRK, Dr. Dupps will go over that procedure in the next video.
Hi, I'm BJ Dupps, and for 18 years I've been performing refractive surgery here at COLI. In this third and final video, I'll tell you about a refractive treatment that has been around longer than LASIK, PRK. Like SMILE, PRK is also considered a flapless procedure. You'll have the same green light to focus on during surgery, but it's the surgery itself and recovery period that set PRK apart from the rest.
In PRK, unlike LASIK and SMILE, the visual defect is corrected directly on the corneal surface. First, the corneal epithelium is dissolved with alcohol and then removed. The excimer laser then sculpts the corneal tissue to correct the visual defect in just a few seconds. Finally, a protective bandage lens is placed on the epithelium until it has reformed.
For people with thinner corneas, PRK is a preferred option for vision correction because it only removes the very top layer of the cornea, leaving the rest for sculpting. Now, since this technique is different from LASIK and SMILE, recovery will be different as well.
After surgery, a soft bandage contact lens will promote healing during the first week. While the majority of PRK patients return to their normal activities after 3 or 4 days, there are occasions where it may take about a week to get back to their usual routine. Like SMILE, a benefit of PRK is that your chances of experiencing a flap issue during recovery are greatly reduced. This is good news if you have a high-energy career or are active in contact sports.
So there you have it. Like LASIK and SMILE, PRK has its own set of pros and cons. So we'll work together to figure out which treatment is best suited for your individual needs. Giving us as much information as you can, like your lifestyle, medical history, or plans for a family, will greatly help us narrow down which procedure is right for you. We hope you found these videos useful and look forward to seeing you soon.